My name is Laura Knight, and I'm with the SIU Clinical Informatics team. I will be presenting the March 2023 TouchWorks Education in this video. First item we have is Paxlovid interactions. The drug-to-drug interactions between Paxlovid and concomitant medications can now be found on the Hive. We've added some new charge codes. These are MHS-only codes and should never be used as part of an SIU encounter. We have a few order changes. RPR keyword has been added to the Rapid Plasmin Reagent RPR order. On the fecal DNA screening, some result tab changes. Insufficient sample has been added. Patient declined, patient refused, and not indicated have been removed. On the SIU only EGD order, the CPT code question has been removed. On electroconvulsive therapy ECT, new or continuation has been added. How soon would they like to start for new, and how many have they had in frequency for continuation, and which medications have been tried. On the endometrial biopsy, hold for authorization has been removed. Stereotactic breast biopsy, CPT code 19801 has been added. On the CMP, BMP, and lipids, patient to be fasting with a yes-no drop-down has been added. On the CT low-dose lung screen, there is a new question. Is the patient on Medicare and over 77 years? If yes, you'll receive a message that states this test may not be covered by patient insurance. Do you want to continue? If so, please obtain waiver. We have some new orders. SIU only referral orders that are added for Carbondale sites only are Shawnee Alliance, Breast Center, and Sleep Medicine. Again, those three are for Carbondale sites only. We've also added SIU only 6-minute walk in office, and this order will auto charge. And cytomegalovirus by qualitative PCR saliva has been added. Some vital panel changes. The PHQ2 question has been changed a little. The question has been removed that states PHQ2 score 3 or more is abnormal, and we've added normal, score less than 3, a pick list of 0, 1, 2, 3 for PHQ, and if abnormal score is 3 or more, pick list 3, 4, 5, and 6. For medication administration, we've added heparin sodium injection, 20,000 USP units per mil with a new NDC and manufacturer. Chart order update. The scan pre-certification pre-authorization document will be placed under the business record. And we have removed a few of our unstructured document types. SIU chemotherapy education, SIU operative report, SIU PEDS formula prescription, SIU SCI appointment letter, SIU SCI chemo consent education, and SIU telehealth note have been removed. On the GI Palm surgery scheduling form, a new location of Taylorville Memorial Hospital, Maine has been added. And for overdue orders, we've attached an overdue order recommendation, job aid, and a work list overdue orders job aid. Problem auto resolve update. The following problems will continue to auto resolve, but will now go to past medical history instead of being suppressed. Acute angina, acute cystitis, gonococcal urethritis, UTI, and acute cystitis with hematuria. The Vitals tab has been added to the SIU ancillary desktop view. For task removal, task should not be removed from TouchWorks unless it meets the following criteria. Task was entered on the wrong patient. Task was system generated and is tied to an item that is no longer applicable. We've added some entries to the drop-down so you can make the appropriate choice when removing the task. These are no matching patient, visit not billable, test not billable, wrong patient, and duplicate refill. Telehealth updates. There's an updated telehealth technology requirements document located on the Hive. Doximity can now be used for telehealth to the home appointments. There will be some upcoming telehealth town halls on Friday, March 24th. and Wednesday, March 29th. Telehealth note updates. We are in the process of cleaning up note types to ensure a more efficient workflow. We would like to update you that the SIU Department telehealth virtual visit notes are the only telehealth notes that should be used. The SIU Department telehealth established and the SIU Department telehealth new notes, note outputs that have the older SIU telehealth visit form should not be used. Your clinical informatics nurse will be discussing this with your departments and making the necessary changes. Some March 2023 helpful hints. Tasking, did you know? Double-clicking a task is the same as clicking Go To. Use Done instead of removing a task, and that will complete the task. RX Renew task. Use this task when renewing medications. This will eliminate the need to remove the task. Patient ID and insurance cards can now be scanned into TouchWorks. We ask that you do not duplicate documents. Follow my health demographic and insurance updates. We have listed here some verbiage we would like for you to use when responding to these tasks. ZZ test patients. We've attached a list of the new ZZ test patients that we would like for you to use when testing in TouchWorks. And then there's also a new job aid for referral appointment if the patient no-shows. For flow sheet result entry, when entering results into a flow sheet, for example, the Coumadin flow sheet, colonoscopy results, or urine dip results, please ensure that you select an appropriate ordering and performed by provider. If the results need to be verified, leaving the ordering provider empty will cause a delay in the result being sent to the provider for review. Springfield Memorial Hospital has made some changes to the way they handle confirmatory toxicology testing. Effective March 13th, 2023, the Department of Laboratory Medicine at Springfield Memorial Hospital will no longer automatically reflex toxicology confirmations on specimens with positive screen results on lab outpatients. For our job aids, we have the overdue order recommendations to show you how to effectively manage overdue orders to ensure patient compliance and safety. The job aid for work list overdue orders to show you how to work orders that are overdue from the work list. Here's our list of ZZ patients now in TouchWorks. Any SIU ZZ test patients not included on this list will be disabled. And the job aid for referral appointment if the patient no-showed, and this will show the correct workflow to use when a patient no-shows the appointment to the referred provider and needs to be rescheduled. That concludes the information contained in the March 2023 TouchWorks Education. If you have any questions or would like assistance, please reach out to the clinical informatics nurse that supports your area. Thank you.